right now about disability, about our experiences, about our aesthetic, mindfulness.
Hmm.
So I've worked with you on a couple of sessions, and I'm going to do
Okay.
more. And
Hmm.
we've had some really good talks, helpful
Hmm.
discussions, um, through Mettle Health, which is your project now. And I would like to maybe use a little bit of my situation with you to kind of
Hmm.
highlight some of the things you're doing that, yes, you're still in the palliative care field, but mental health is so much more than that. And I'd really, if it's okay with you, I'd like to kind of dive into your work, but kind of use me as an example so people can get a better understanding of what you're
Yeah,
up to, what you're trying to do.
that'd be beautiful. I'd love that, and I really appreciate you going personal, Gustavo. That's. I wish the rest of the world found a way to do that. It's a totally adds a whole other dimension. So I really appreciate your willingness. So yes, let's dive in.
Awesome. So I reached out to you. We had a session, and uh, can you just give people, like, give the listeners just a quick,
Yeah,
2 minute idea of what mental health is and what you're trying to do?
yeah. Thank you. Yeah. So Mettle Health, first it's spelled Mettle, metal, as in like one's inner strength, one's inner reserve. So metalhealth.com is an online palliative care counseling and coaching business that my partner Sonya and I started last year, about a year ago or so. Um, so that's the main, that's what that is. But you got to have to understand what palliative care is, and we can get into the weeds a little bit. But that's the marquee. But settling into what we actually do. So a couple of different things about our model. One is that it, palliative care is an amazing approach to health and approach to care. So it's something of a philosophy, and it tends to be it is born in the healthcare, the medical model, but there's much about it that is not medical. And one of the things for me was to I left my clinical work at UCSF, where I was working in the cancer center for many years doing palliative care. We called it the symptom management service, but that was very much to a medical model. And there's a lot to say about the medical model. But suffice to say, at least for now, that the medical model leaves a lot of stuff out. And the medical model tends to pathologize people. And the medical model, as you and I both know, has been a mixed blessing for us in the disability world. Um, there are other ways of looking at of understanding a life besides just the sort of biosciences, and there's more to an experience in a life than just sort of a diagnosis or a disease state. So mental health was, and palliative care itself as a field is meant to help blow up the medical model a little bit and welcome the emotional, the social, the spiritual aspects, the experience of living with illness, not just a transaction of trying to treat a disease. So palliative care in its base is trying to be this much bigger thing, this portal to upload other interests besides sort of molecular interests into the experience of care. So that's an aspiration for the field. So let me just digress a little bit more, because a lot of your listeners, you may have heard of palliative care, but it's generally conflated with hospice and end of life care. Um, what's really important is palliative care as a field did it grew out of the hospice. Hospice came first in this country. But in the 80s, hospice defined itself as an insurance benefit and limited this kind of care to people who had 6 months or less to live and who gave up to trying to cure their illness. So that's how you qualify for this kind of care called hospice in our country. Well, so that's lovely in a lot of ways, and many people have benefited from hospice. And I understand why the government put those limits on it back in the 80s, is to name this structure and to pay for it. But the truth is, of course, like there's no magic to 6 months or less to live. It's not, and A and B, we're terrible at prognosticating anyway. People often either over or underdo our prognosis all the time. And so there's also this crossroads, this fork in the road. Like, why would we ask someone to give up anything to get this kind of loving support. So the field of palliative care grew up in the 90s, trying to push to blow out the walls of these limits around this hospice idea. So now palliative care is simply the sort of interdisciplinary pursuit of quality of life. That's the cleanest way I might be able to put it. So, in that definition, any definition of palliative care, you won't see any mention of death. We don't run away from death, but we're not focused on death necessarily. And hospice is a subset of palliative care. It's a kind of palliative care that is devoted to the final months of life. But otherwise, palliative care, a lot of my patients, have years to live. A lot of when I was in the medical world at UCSF, I've had patients for 10 years. And so that's all backdrop to say, with Mettle Health, we wanted to take this aspiration, this potential for this philosophy, this approach to care, take it, try to even pull it, make it bigger by pulling it outside of the healthcare structure, the limits that go with healthcare as an industry. Because if your subject matter is quality of life, so abating suffering, finding joy, making meaning, these are not medical things. And so I realized that we were, in the healthcare structures, we were unnaturally curtailing or limiting the huge potential for this field to touch many more people, to be relevant to many more people. So for that was a big impulse of Mettle Health, was to pull it out of healthcare. We let go of the medical piece. I am a doctor, fine, and I'll talk to people about their medical things, but I'm not becoming someone's doctor through Mettle Health. That's an experience, a body, a skill set that I have that informs how I talk to people, but isn't the whole enchilada. And so I don't want to necessarily just become yet another doctor for people who often have too many doctors, but rather I will sometimes coach people how to use their doctors a little bit better, how to communicate with them, how to navigate this crazy healthcare system. So right. So we got rid of all the structures at LIM. We don't need a doctor's referral to come to us at Mettle Health. We have nothing to do with health insurance. And you don't even have to have a disease to qualify. Whereas if you were to find a conventional palliative care program, to qualify, you'd have to have some serious diagnosis. And there again, you bump into these man-made limits. We're trying to get rid of those man-made limits and open it wide open. So that's sort of the impulse for Sonya and me to start Mettle Health.